Thank you.
Over to you.
Great, thanks. All right, so today I'm going to be talking about how to design safe visualizations for patient data. Now, if you've done any type of dashboard or visualization design, you'll know that there are a lot of great tools out there that make it very simple to take complex data and create beautiful visualizations from them. And with a click of a button, you can actually totally change the type of visualization being used. And this is very, very easy and exciting, but can also be dangerous when we're talking about clinical data. So we have to be very careful. And as Tobias said in this quote, a detailed chart is not necessarily a factual chart, and the most beautiful, easy to understand chart can still be misleading. And within healthcare and the medical industry, our stakes are just too high to not be very careful when we're talking about this. So just an example to highlight the importance. So imagine that you're a clinician reviewing a patient's potassium levels. So you're presented with this graph. Things seem to be kind of trending in an okay direction. Everything looks okay. Then you switch to another patient, and that trend line is very similar. And again, you're just kind of moving through your patients. You're very busy, and things seem to be okay, and you move on. However, what you didn't realize is that Liz's graph here, the y-axis went from 2 to 6, while John's actually went from 3 to 9. And because of changed blindness and just that slight tweak of the axis labels on the left, and because the trend line, that pattern was so similar, we might have completely missed that those values changed. And unfortunately, John's values are really reaching a critical clinical severity. And if we were to plot these graphs on the same y-axis, we would see how considerably higher John's values were from Liz's. And with really high levels of potassium, this can lead to something as serious as cardiac arrest. And so as you can imagine, we want to make sure that we are providing our clinicians with the right data in the most safe way as we can. So there are many complexities to consider and guidelines to follow when creating visualizations with clinical data. And that's what we're going to be talking about today. So my name is Jody, and I am a global user experience strategist, which is a mouthful. I also lead the European UX team for Cerner, which is a healthcare IT company. I have over 5 years of data viz and dashboard design experience specific to healthcare and clinical use cases. And I'm currently based in London. So to start, we're going to look at a few of the complexities of clinical data visualizations that just kind of separate our industry from other types of more consumer-based or just other types of kind of data tools. And with a lot of the examples that we saw at the beginning, those are usually built for more simple use cases and don't necessarily account for the complexities that we need to consider within the healthcare area. So we'll look at 3 examples, first being kind of the history of paper charting. Now, this might be familiar to some of you. So paper observation charts are still used in a lot of places around the world today. This is typically a physical paper at the patient's bedside where vitals and other measurements are being tracked for a particular patient, and you can kind of see if the patient is improving or deteriorating over time. Now, these graphs can get quite messy, as you can see, especially in this example with really thick grid lines, and this photocopy version makes it kind of hard to distinguish where the data is and what are those different lines. So there was actually some research done in Australia and New Zealand several years ago on a lot of these different types of paper graphs because there really wasn't much standardization around this early on. So they conducted a heuristic analysis of 25 patient charts, which revealed over 1,000 usability problems, which is quite significant. And they used those results and some best practices and user-centered design to create a standard chart, and this is called the ADDS. But then they actually retested that like any good UX person would do, And they compared that to kind of two versions of that graph, that chart, as well as a number of other examples. And they found a lot of interesting things in this study, and there's been a lot of other research done on this area as well. But something that really stuck out to me was that errors can occur at either the level of making clinical judgments or at the level of recording data. And furthermore, they found that there seems to be some type of trade-off between the ease of recording data and the ease of detecting deterioration. And so the graphs that were good at one of those were not very good at the other. But as you can imagine, within a high-intensity clinical situation, we need both of these and to be true of the tools that our healthcare providers are using. So as we've kind of started the digital transformation of healthcare around the world, here's just one example of a digital graph now that was built. And as you can see, it's almost a one-for-one of just kind of bringing that concept or functionality into the EMR. And this is actually quite true of a lot of functionality, not just graphs. And that has led to a lot of problems and ultimately a lot of the physician burnout we see in the industry today with just trying to take something exactly how it was on paper and making that digital. But I'd really love for us to go a step beyond that in our products today and consider a few things. First would be, how can we actually make sure that we're creating safe and easy data entry, as well as accurate and simple data interpretation, which is actually meaningful, giving actionable visualizations instead of it just being a pool of data, making sure that it's contextual to clinical workflows and roles, and collating data across sources and systems. And as we know, with a lot of the challenges we're facing today with interoperability, and even just the complexity of vitals being pulled in from different sources or different methods, it's really important to make sure that we're taking all this information and giving it back to our users in a meaningful way. So the digital transformation of charting patient data is a big challenge, but there's also still a great opportunity to go above and beyond where things are today and provide more value to clinicians. So next I want to talk about mass metadata. And in this example, this is actually an example of a critical care dashboard, and this is within Cerner's products. This was designed before our UX team was built. I would definitely make some changes to it today, but you get the idea that there's a lot of data going on. They are keeping an eye on all of these measures of the patient in this really intense situation. And if we look at just one example of temperature, this is what we would call in our system a DTA. And a DTA stands for discrete task assay, and this temperature is one example of over 9,000 DTAs that we have in our system. And that's essentially just something that means that we can kind of record that as a type of data in our system. And for every DTA, there is a huge amount of supporting metadata. So some examples, as you can see, are the unit of measure, the data source, the activity type, etc. And of course, all of this information is important, probably at some point within that patient's care. Now this example is a pretty standard project management Gantt chart. Gantt charts are a great type of visualization for showing things over time, showing history, but also what's coming. And in kind of a typical project management use case, you would want to be showing what are the tasks and when are things going to be starting and stopping, what dependencies are there, etc. So here we have about kind of 6 concepts that we want to show visually. Now this kind of visual metaphor of a Gantt chart actually works really well for the concept of medication administration. So being able to see orders over time, administrations as they've happened, upcoming administrations, etc. However, we have to include a few more types of visual indications beyond the concepts that we see in something like a project management chart. And for all of these things listed on the right, these are the things that were given as design requirements that need to be shown face up in some way, that are ranked high priority, that the patient needs or the provider needs to see. And of course, as you can imagine, beyond this, there's additional data that they'll need to drill in or access at some point later as well. So a few additional things to consider are different statuses for both the orders and administration. So if something is overdue or was not given. And then something like infusions has additional concepts that needs to be included, such as rate changes, boluses, etc. So we're trying to take these, kind of great visualizations, but adding in a lot of extra concepts that simply the tools in our industry today just are not built for. So clinical data have relevant and considerable metadata, which support decision-making for patient care. And that's really important to know. So third, EHR regulations. So here's a giant list of acronyms that you're probably familiar with, at least some of these. So both, nationally, regionally, and internationally, there's a number of regulations that impact all of our work, whether it's for patient safety, patient privacy, accessibility, etc. And something that was really surprising to me over my past several years at Cerner is how much these things actually really kind of drip into and impact the way that we're designing our products. And one example of this is the Web Content Accessibility Guidelines from W3C. We'll talk a little bit more about accessibility later, but just wanted to highlight a few examples of criterion from this huge, amount of guidelines that actually directly impact visualization and dashboard design. Again, we'll look at some examples and talk about this a bit more later. But it's really important to know that all of these kind of mysterious acronyms actually can impact the things that you're creating. So it's integral to understand the regulations applicable to your products and ensure adherence to them. So these three complexities are some things that are quite unique to the healthcare industry and really separate us from a lot of the other tools and things that are being built today that just aren't necessarily considering the additional use cases that we have. So next, let's look at some guidelines that we can follow to create safe, effective, and accessible visualizations. So first, we're going to look at safe. So we want to ensure that we are portraying the data accurately to the user so that we're avoiding any type of misinterpretation, misunderstanding that could lead to error, patient risk. Now this is quite simple, but something that I see all the time is just poor usage of labeling. And in this example, this graph is just called project category. There's an acronym on the left with no explanation, and it's really hard to know what's actually going on. So being very descriptive and clear in the way that you're labeling the data, not giving any room for misinterpretation is really important. Something I often see on dashboards is that when we have two graphs or more even next to each other, there isn't a lot of thought about how those things might kind of compare to each other or are part of a bigger picture. Now the graph on the left, the axis goes from 0 to 30, while on the right, it goes from 0 to 90. And when we're talking about percentages, you need to be very careful to always show the full 0 to 100% to give that right perception of the data. And especially when we're comparing across like this, even if there isn't necessarily a patient risk and comparing two things directly, it's still just a misrepresentation of the data. So if we shift that to actually be from 0 to 100, you see that there's a huge difference in the way that that's being portrayed. Now, scale can be used kind of for good and bad. In this example, we see that this graph is scaling very nicely and responsively, but you'll notice that only the x-axis is changing and the y-axis has not shifted. So as the data has gotten squished, the trend lines look like they're much more severe or kind of more intense with those angles than they were at full width. Now, this is just something to kind of be aware of as it can help or hinder the interpretation of your data. When we're talking about something like temperature, especially in Celsius, there's a very narrow range that the patient's normal temperature should fall within. And if we have a lot of values on the y-axis, it can kind of look like a flat line or be kind of hard to see how that's really changing. So if we kind of zoom in and have a more narrow y-axis, then we can really see how that temperature is fluctuating a lot more easily. So be aware of how scale is impacting the perception of your data. Something I also see is that if you have kind of a null value, that interval is just dropped off completely. So in this week of data, Friday is just not represented because there was no data. But it's really important to make sure that we still include things like that to give the true kind of story of how that data is changing. Now, if we think back to the example of John and Liz with their potassium values, something that would have really helped in this situation is to have given the viewer more context to the data. So for most clinical values, there's something called a reference range, which shows kind of that normal and expected range of values. And by simply adding this visual context to the graph, it's much more clear that Liz's values are within range and okay, while John's were significantly above. So even though the y-axis was still changing between the two patients, adding that additional context made that more clear. Now, for something that has a kind of single discrete value that is the expectation to meet, we can also use something like a goal line or a reference line to help make that just a lot more quick to understand for the user. So we can create safe visualizations by ensuring your users interpret data correctly. And we can do this by providing clear labeling, proper scale, and visual context. So something else to consider with safety is to provide access to details. So if you remember from the critical care example, every single data point has a huge amount of metadata that is important to have available. Now, we probably can't put all of these things face up or even in one giant popover, but we can be really careful with how we are prioritizing this data and allowing the user to access the additional details. But to know kind of how to manage all of this, we need to really understand the clinical workflow, their goals and needs, and the decisions that they're making to make sure that we can provide the right details at the right time along their clinical workflow. And there's lots of great methods of progressive disclosure that can be used to elegantly give a bit more information at the right point in time when it's necessary and to have that information. You can also use, a full kind of drill-in view. So just be really intentional with how you're structuring the overall data experience. So we can also create safe visualizations by providing your user access to details. So make sure to include metadata that's relevant, anticipate user flow, and utilize progressive disclosure. Next, let's talk about how to create effective visualizations. So we want to verify quick understanding for our users. So we know that there's a lot of details we need to include and a lot of things to make sure that, that they're not misinterpreting the data. But we also want to balance that by not, creating cognitive overload for our users and making it very quick to understand what's going on. And with over 50 different types of visualizations to choose from, it can be kind of challenging to know what type of visualization is best, and easy to just kind of click through those fun tools and see what looks the most cool or interesting. But it's important to know that every type of visualization has a different data story to tell. And this is something I could probably talk about for a whole hour, but we don't have that time today, of course. But it's important to be careful when you're choosing a visualization type. So as an example, we're looking at patient's medication over time, and you can see that the dose has kind of gone up and down over the past several hours. But because these are connected by a continuous line, it looks like an infusion almost, that the patient has been getting it every moment throughout this period of time. So a bar graph actually might be more appropriate to show that these were separate individual events that happened over time, but still being able to see kind of how that went up and down. Now, these are the different types of visual encoding methods. So kind of a layer down from visualizations. These are kind of the different elements that we can connect data to help portray it visually. And there's been a lot of great research done on these as well to help show kind of which are more accurate in the way that we interpret them and have a prioritized list of how we're relying on those different things. So again, would love to go more into detail. This is a study by Cleveland and McGill that you can look into. But again, being aware, being intentional with how you're choosing to portray that data is very important. Just a quick side note, please avoid any use of 3D or textures or skewing the data. All of these things just really distort and make it hard to interpret what the data is saying. But I still see it more often than you might think. So if we think back to this example of a paper chart where there's these really thick grid lines, kind of hard to see where the actual data is, this is very akin to Edward Tufte's data ink ratio. And so when we think about kind of all the pixels that we're using in a visualization, here this is a little dramatic of having everything bold and really thick lines and some dashes, and it's very busy, and it's really competing with the data itself. And so we want to make sure that we're reducing as much as we can that supporting information so that the data comes forward and is clear to the user. So we need to include certain things so that we're still giving them the ability to interpret the data correctly, but we still want the users to be able to truly focus on the data itself. Now this is a visualization that you might be familiar with. This was one of the first examples of a flatten the curve graph from the CDC. And someone named Drew Harris kind of took this concept and did something quite simple. He added a dotted line that said healthcare system capacity. And so as we've gone through this coronavirus pandemic, this is something that has gone quite viral and has been a powerful way for people to understand how they can have an impact on protecting our healthcare systems. And Drew himself even said, I added an extra line to it, and apparently that made all of the difference. And so annotations can be a really powerful way to help people connect with and kind of orient themselves to the data and how it impacts them in that particular moment. And as you can see, this visualization has just been really gone all over the internet and has become quite popular over the past several months. So annotations can help when we have a really complex visualization. So here there's a lot of data showing Twitter activity for US news a few years ago. And if we just use kind of simple annotations and highlight those most important things, it's easier to kind of understand and see the full story and picture of the data. So we can create effective visualizations by verifying quick understanding through choosing the right graph type, focusing on the data, and utilizing annotations when relevant. We can also create effective visualizations by indicating clear actions. Now, if you've been in a car and you see this light come on, you're probably prompted to pull over at the next gas station that you see. So that's pretty simple and straightforward, and you know what you need to do immediately. Unfortunately, with a lot of dashboards we see today, that action or next step is not so clear. So here we have maybe some orange that looks like maybe that might be more important, but it doesn't seem to necessarily be something we need to draw our eyes to. So again, thinking back to our potassium graphs, we added some visual context with this reference range, and that helped kind of tell the story a bit better. But for John's data, if we had actually gone a step further and to help make that clinical severity more clear, in this case by adding a bright red stroke around those data points that cross that threshold, this is a lot easier for the clinician to know where the problem is and where to take action. And an example of a more complex dashboard, here's a couple of ways that helper text has been used to help guide the user through how to interact with the data, showing them where there are affordances and guiding them through step by step. It can also be clear with the way that we're labeling filters, even providing a type of help menu to show them how to interact. So we can also create effective visualizations by indicating clear actions for your users. So we can do that by prompting next steps, indicating clinical risk, and including signifiers to help highlight where those affordances are. So thirdly, we'll talk about accessibility guidelines. And I'm definitely no expert, but this is an extremely important thing that hopefully you've been talking about in your organizations already. And I'm thankful to work with a whole team of experts in this area. So I won't dive too much into the details, but we'll highlight a few important things here. So first, we need to make sure that we're supporting assistive technology. And this is also relevant for visualizations and dashboards. Here's a few examples of assistive technology, which are ways that users with different abilities can interact with and navigate computers. These typically use a similar system to a regular keyboard. So if you're keyboard accessible and you can operate and navigate with a keyboard, there's a better chance they're able to utilize these types of technologies. Now, something that's really important for making sure that those are working properly is semantic code. So here's an example just with some basic HTML5 markup. And the importance of semantic code is that we're providing clear hierarchy and structure, giving the right elements so that the technology knows how to render that and enable the user to go through your product. It's also an accessibility guideline to always include a textual equivalent for anything that is represented visually. So for any type of dashboard or visualization, at the minimum, we should have a data table that includes all of the data represented in that visual. As you can imagine, having a screen reader read off an entire table of data to you is probably not the most enjoyable experience. And there's a lot of great work going on within the natural language generation space, where there's technology and tools that are going through data, just pure data, pulling out the insights and giving a summary to the user. And so listening to something like this, of course, would be much more effective and enjoyable. And as you can imagine, this is actually a huge enhancement for sighted users as well, to be able to see visually the data, but then also see immediately what those important takeaways are. So we can create accessible visualizations by supporting assistive technologies through writing semantic code, including textual equivalents, and considering natural language generation tools. Now, another important thing to consider with accessibility is color. And color is another fun topic that I have done full talks on, but we'll just go through a few highlights today. So in this example, we have two different data variables, and there's different colors to distinguish them. So in principle, that makes sense. However, it's not enough to rely on color alone to communicate some type of information. So a few different methods that we can use to add to color are kind of direct text labeling, shape, especially in line graphs, pattern, and shade. And I'll talk about that again in a few slides. So if we simply just change the shape of the data points for that second data variable, now this is more accessible because, of course, with a legend item and title and everything, the user would still be able to identify which data without having to rely on color. Kind of the best way to test this is to simulate or even print out an example of your visualization or dashboard in grayscale and see if you can still match the data, pass it to someone next to you and see if they can do that as well. This helps make sure that there's nothing that's color only in what you're designing. Something else to talk about is, of course, color blindness. So most of you on this presentation today can see where the values are high and low, but for about 10% of the population, it would actually look like this, which is not very helpful. And this isn't just about computers, but with this American football match in the NFL about 5 years ago, these uniforms of red and green were just so similar. They didn't even have different socks to help distinguish them. And it was literally impossible for colorblind viewers to be able to follow this match. And there's quite a bit of talk after this. And sometimes I hear, oh, well, in healthcare, doctors could never be colorblind. But of course, we know that that is silly, and there's those things impact everyone. And so it's important to make sure that we're considering colorblind users and designing for them as well. This is a tool called Color Oracle that you can just have plugged in and simulate different types of color blindness, as well as check grayscale. So it's across different systems and is a nice way to just kind of check as you're creating a visualization. Now, a few tools for color contrast. So if you're familiar with accessibility, you'll know that for text, you always need to pass a certain contrast ratio to make sure your text is readable. But there's a new guideline with 2.1 that calls out graphical objects specifically. And so now these types of user interface components also need to meet a certain minimum ratio of 3.1. And delta E is the difference between two colors. And in this example, these two greens are very similar and they have quite a low, low value. If we change that, we see that that increases quite a bit. So for kind of the colors we're using to plot data, we need to be meeting at least a 3.5 difference between two colors. These are all things that are fully called out within the WCAG 2.1 guidelines as well. Now, another problem I often see is just overuse of color. And when we have dashboards that just have so much going on and there's color everywhere, it's really hard to know how to actually focus your attention and take a next step. I often see bar graphs that give a different fun color to every item, but that's really not necessary if they're from the same data set. So we can reduce the color that's being used and keep that all monochromatic. But we could even go a step further and just use color to highlight the most important information for the user to really help them focus in on that. So don't be afraid to use gray or other neutrals and really reduce the amount of color in your visualization. So we can create accessible visualizations by using color carefully. So do not rely on color to convey information. Make sure to check color contrast ratios and avoid overuse of color. So we've looked at 6 guidelines for designing safe, effective, and accessible visualizations and dashboards for clinical data. So how can you take action within your organization based on this? So again, just remembering that, that not all data is created equal. Within healthcare and medical scenarios, our use cases are more complex and our stakes are a lot higher, and we need to be careful with how we're designing. And we want to make sure that we're applying guidelines that we've just talked about for safety, effectiveness, and accessibility. So a few kind of concrete steps that I would recommend are that within your organization, you develop standards and consistency for anyone who's creating any type of visualization or dashboard. Of course, make sure that you're always designing for user goals and needs. Again, I often see just so much data because, you know, maybe a doctor's saying, I need to see everything, but actually understanding what they need at the right time in their clinical workflow is so important. And of course, conducting user research to test and validate what you've done and make sure that it's meeting the user's needs and doing that in a safe and effective and accessible way. Thank you.
And the first one is from Flavio. And so we have a question here. You mentioned change blindness for John's potassium levels. What are the recurring biases you come across for data visualization for judgment, not recording?
For judgment, sorry, what was that last word?
In brackets, it said not recording.
That's a good question. I'm not sure that I have a great answer for it, to be honest. I think I'm sure there's more research that that I haven't seen on that as well. I think that generally, kind of with that paper to digital transformation, you know, people are used to being able to just jot something down or seeing that. So I think that, you know, there's just kind of a perception of, oh, well, because it's on the computer, it's slower. But there's a lot of opportunity for us to actually improve that and change that and give them a much more, not just kind of improve the experience that they used to have on paper, but show that there's a huge amount of value in providing them additional data and safety through a system that's through system and technology.
Any books you could recommend on UX data?
Yes, I should have. Yeah, I can share some afterwards as well. A few that come to mind are there's several by Edward Tufte. There's what's the good charts, something simple. Let me find a few things, and I'd be happy to post that later.
Oh, fantastic. Okay. When it comes to testing designs, prototypes for dashboards, which tools do you usually use? Do you test with real interactive data? In brackets, it says Shiny R or working prototype for more complex application?
Great question. So in some of the complex visualizations that I've tested in the past, I have front-end experience, and I found it easier to just create an HTML prototype myself, and to be able to kind of simulate some of the animations and navigation and data. So I've used just kind of a data source from a coworker who's a clinician to make something realistic of kind of a simple data set to use. Of course, there's lots of sample public data sets that can be used, and for a tool that's a bit more simple, like Tableau, you could actually create a full dashboard and test directly from that. So I also have had, so someone who was working on more of a Gantt chart type view was able to put something together in Axure that worked pretty well to kind of simulate that type of experience.
Okay, great stuff. Thank you for that. I see Tim's also based in the UK. He just mentioned here, Stefan Anderson is a great UX data principles and guidelines. So that's a good reference there as well. So we have another question here from Frederick. Given the amount of data a clinician needs to help with decision making, how can you give a meaningful overview? Another question is, how do you prioritize which data to show and when?
I think a good rule of thumb is trying to keep a single goal per visualization or even dashboard. So I often see, kind of a challenge where you have, someone saying, okay, well, my executive needs to see X, Y, and Z, but the same dashboard needs to also work for middle management and all the data analysts. And that is just, you're going to have a mess of a dashboard if you're trying to meet 3 different user roles and all of their goals within one solution. So trying to, really focus and show exactly what the data is for a single goal at that point in time in the clinical workflow. So I think that's the easiest kind of rule of thumb, is just to not and really push against things getting overloaded, because the more that you start to add in, the harder that's going to be. And there might be, again, that kind of perception that, well, if I see everything, it feels like it's in my control and that I have what I need. But if we can actually design something well enough to bring them through a smooth workflow, giving them the right things at the right point in time, I think that we'll find that clinicians are actually more happy with that.
Okay, fantastic. And we have one from Sabina. Her question is, do you have experience with real-time data visualization in terms of perception, benefits, etc.?
I personally do not quite as much, but there's some others on my team that I've worked with who have. We have kind of this gigantic screen in one of our offices that shows some data for like current sepsis alerts going off, or the number of babies that are being born, and kind of track within our software for that day. So of course there's a lot of additional complexities that go into something as fragile as kind of a live data stream. So I think that things that are important for that are to also consider being really clear with, communicating that it's live data, where it's coming from, and then if there's any type of interruption or pause in that, to make that really evident to the user, so that, especially if they're making a clinical decision based off of it, they know if that's the source of truth or not.
Okay. Thank you very much, Jody.
You're welcome.
It was a fantastic talk. And as you can see from the chat on the side there and the questions, I think a lot of people found it extremely useful. We do appreciate it. So thank you so much.
Thank you.
Okay.